and you will get that recording either later on today or tomorrow morning. So keep an eye out for that. That'll come directly to your email. So if you want to go back and reference anything that's covered, you feel free to do so. And then attached to that recording is actually a quick questionnaire. So we really want to value your opinion on the presentation. Did you enjoy it? Did you find it valuable? Based off of the feedback that we've received on this one already, a lot of people do enjoy this. So we do value that opinion of yours. So make sure that you are filling that out along with going back and watching this recording. The chat is open. So if you do have questions, feel free to post them into the chat. We will have a designated Q&A at the end of the presentation. So if you want to take yourself off mute and ask the question, you can certainly do that. Or like I said, post those into the chat. And from here, what I'm going to do is I'm going to pass it off to the team at the Princeton Review. Megan, you want to take it from here?
Thank you, RJ. Hi, everyone, and thank you for joining us. Welcome to Understanding the Nclex RN. I'm Megan Haverkamp, and I am an outreach specialist with Princeton Review, and I have been working helping students and individuals reach their academic and professional goals through test prep for over 15 years. I will turn this over in just a moment to our expert speaker. But first, I'm going to give you a little information about Princeton Review and our Nclex test prep. Next slide, please. Oh, there we go. Perfect, thank you. So Princeton Review has been around for over 40 years, helping students pass high stakes exams, particularly in high school. Some of you may have known or taken Princeton Review for the ACT or SAT. They then got into grad school exams, so the MCAT, the LSAT, GRE, GMAT as well. And recently we have moved into professional studies. So these are high stakes exams, obviously, that you have to take to become licensed in your career. And we now have Nclex test prep. And we have 3 fabulous ways to study. We have the Nclex RN Q Bank, and that is strictly 3,500 plus questions. 1,900 of those were purchased from the NCSBN. So this is kind of subscription based. So this is based on like how much time you want to have some extra practice questions. We have a 30-day, a 90-day, and a year subscription. Our next product is our live online classes. These are really for the people that would like a little more structure, a time, a place to be. It's online, not in person, but you still have a time of class. You have an instructor to ask real-time questions, and you have classmates who will, it's what's the saying? Misery loves company. So you're all kind of in it all together, and you have stories, and people ask questions that you didn't think of, but you thought, but really helped you. And so you kind of have a study group. And then our next is our self-paced, which is really, you get your practice questions, but then it's on your schedule. It's really up to you. You set it, you go through your lessons, you watch the videos, you do some practice questions, and so really kind of covering every type of person's study preference. And so those are our test prep. Next slide, thank you. All right, so let's jump into the presentation. Today we're going to talk about activity statements, sample questions. We're going to work through a few problems so that you can kind of get some tips and tricks of how to approach taking test problems. Then, of course, everybody has heard the exam has changed a little bit. So we're going to talk next gen, and we're going to talk about what changed and what hasn't changed. So you really have a good understanding of what it is. Sometimes knowledge really helps that fear of the unknown, and we're starting to get feedback of what the exam was like. So there's really, hopefully, by gaining this information, it'll bring down your anxiety of a big test exam change. Then we're going to talk about our individual preparation plan, kind of some tips on how to study for this high stake exam. So that's our agenda. And I would like to turn it over and introduce Melissa Feldman. She is a dedicated labor and delivery nurse and also a nurse educator. She recently joined Princeton Review as one of our live online instructors. Melissa, it's all yours.
Awesome. Thanks so much, Megan. Can everyone hear me okay? All right. Can you hear me okay now? My thing keeps muting itself, so we'll see how this goes. All right. So we're just going to talk about, like Megan had said, the Nclex exam in itself. So the Nclex is designed to test your ability to think like a nurse. It is different than any other exam that you've taken before. A lot of nursing school was more, you'd kind of memorize knowledge base, things like this, things like that. The Nclex really wants to measure your clinical reasoning, clinical judgment skills, and are you able to recognize the things that are important in nursing? So that's how they determine that. So some quick facts about the Nclex in itself. This, obviously, as you know, is the entry into the practice of nursing. It's how you become a registered nurse. The NCSBN is the National Council State Boards of Nursing. They're the ones who write the exam, are responsible for that. This exam is offered continuously throughout the year. You can take it anytime. It's the same exam nationally, no matter where you go, you're taking the same exam. And it is a pass-fail exam. So, of course, there's a scoring associated with it, but you either pass it or you fail it as far as moving forward. So a lot of people, as Megan had explained, get kind of uneasy about how the exam is changing. So at the Princeton Review, we like to focus on what is not changing, okay? So we'll touch base on some of those things first. So the time to take the exam is going to be the same. You still have the same amount of time. It is still a CAT exam. So if you're not familiar with what that is, it's computerized adaptive technology, I believe. So the next question in your exam is based on how you answer the first. So other type of tests and exams you might have taken in the past, you could go back, change your answers. This test is kind of a smart test, if you will. It's adjusted based on how you answer your previous questions in a way to, they're not going to have you use all the items available if it's not necessary. It kind of has this algorithm to determine if it has enough information. So that is the same as in the past. All right. You will still have the use of a calculator provided on the test screen. And one of the biggest things is that you still need to fully understand the material and not memorize it. The rigor and the content of the exam, everything is, that part is still the same. It's just how they're giving you information and how you're answering questions is different. And we'll talk about that in a little bit with the different item types. But the knowledge you need to know and that you need to understand things, that's not changing. That is still the same. It is still, as mentioned here, the rigor and content. It is still, you know, a tricky exam. So you need to just go at it as you would any other exam, you know, like you would before the next gen. It's still going to be tricky. All right, this is a list of the client needs categories. So throughout the test, there is a percentage of types of questions, and we'll get into all of these client needs categories with our activity statements, things like that, so you get a better feel of what these mean. But this is generally about how the test is weighted. You have to pass all the categories, okay? But as you're studying, just kind of understand maybe if you're a little weaker in management of care, you can see there's a higher bulk of the questions with that. So maybe focus your energy there. But generally, you can see how it's weighted. And they're not you're not going to get all your safety and effective care management questions and then move on to your health promotion and maintenance. They'll be dispersed kind of throughout. And you can see the difference between the 2019 and the 2023. So even in that, there's not a huge difference as far as how the client needs categories are kind of divided up. All right, now we're going to review some of the activity statements, review the client needs categories, practice questions. We'll go through those. When we get to the practice questions, I understand everyone is probably at different levels in the program. So if you haven't covered the content yet, it's okay. Just play along. Put your best guess in the chat and we'll break down each question as I would in the live online session, but also just how you can work through these Nclex style questions also as you're going through practice, okay? Okay, as for the activity statements, we want you to consider these as the knowledge, skills, and abilities that are identified that are expected for new grads to perform, to understand, and provide safe and competent care. So this is just the Nclex is kind of baseline for new grads. It's developed through experienced bedside nurses, nurse managers, nurse educators, just stakeholders in general, all have a hand in developing this exam. And like I said, applies clinical reasoning, clinical judgment making, or decision making, and clinical judgment. As you'll see here, this QR code will take you to the 2023 Nclex test plan. This is published by the test makers. So we recommend using this kind of as a study guide. Now it doesn't give you questions, but it kind of guides you how the layout is. And it is pretty lengthy. So that's kind of what we'll cover in a nutshell as far as the activity statements and things like that in this presentation. All right, now we'll touch base on the client needs categories. And like I said, complete some practice questions for most of these, and then we'll get into kind of more next gen specific information. Okay, so first is management of care. This is where the nurse provides and directs nursing care that enhances the care delivery setting to protect the client and healthcare personnel. And you can see here, there's different examples of concepts. This includes client rights, advocacy, how you're using information technology, prioritization, assignment delegation, supervision. All of those type of things are included in the management of care category. Oops, hang on a second. All right, so that leads us to our first question. I'll read through this in a second, but I want to explain to everyone how we can use questions as study tools. As you can see here, you have your standard question. If you get into some kind of Q bank, question bank, or as you get going, this is more than, you can use this as more than just practicing answering questions. Don't just crank them out. There are lots of ways to use this. So generally, as you go through a bank of questions, they will also give you a rationale. So after you're doing practice questions on your own, I don't want you to just do the questions, see your score, move on. Really focus on the rationales and look at, why did I get this question wrong? Is it a knowledge recall problem? Did I read the question wrong? Where are the patterns here? Am I really not familiar with this topic or this? Do I need to review this? Or I really need to slow down and read every single question or every single option? So really using this as a study tool rather than just cranking out question after question after question is going to help you, going to benefit you as far as working through these questions and better answering them and understanding them. Okay, so that being said, our first question is a prioritization question. So the nurse is assuming care of clients from the previous nurse. After receiving a report that all clients are stable, which of the following clients should the nurse plan to see first? A client who has a scheduled surgery in 1 hour. B, a client who is ready to be discharged home. C, a client who is 4 days post-op after an appendectomy. Or D, a client who is admitted for IV antibiotic therapy. Can all go ahead and throw your answers in the chat, and then Megan will kind of let me know what the consensus is here.
Okay, sorry, I was on mute. I'm seeing some A's and D's.
Okay, as I expected, that is typically how this question goes. So let's break this down. I want you to understand that this is a prioritization question, right? You can figure that out. Who are we going to see first? But pay attention to some of the keywords. All your clients are stable, okay? So I think we've decided, it sounds like A's and D's. So let's just, to keep it short, we'll kick B and C out, right? So we understand that all clients are stable. What is also trips people up in questions, especially multiple choice where there's not a lot of additional information, is students want to add information in if they don't have it. This is kind of where some people are enjoying the next gen item types, because you have a lot of information instead of inputting it here. So I will have people who pick D because immediately you have, a client who's admitted for IV antibiotic therapy. They're probably septic. They're probably critical, is where your mind takes you sometimes when you don't have information and you see that type of answer. But we must remember that all the clients are stable. They might be just perfectly fine, but are requiring an antibiotic therapy. So in that case, if we're looking at prioritization, we would look at we're looking at things that are time sensitive. So we have a client who's scheduled for surgery in 1 hour. They likely need some pre-op teaching, some pre-op assessments, some pre-op prep. So making sure they're ready to go for their surgery would be the appropriate answer, because we know all these other clients are stable. Okay. Does that make sense? That's how you can kind of work through those. Pay attention to some of those keywords and don't add additional information where they don't have it. Okay, and then safety and infection control. This is pretty self-explanatory. This is where the nurse protects the clients and healthcare personnel from health and environmental hazards. This includes accident, injury, or error prevention, home safety, safe use of equipment, standard precautions, restraints and safety devices, things of that nature. Okay, we have another question. So the nurse is caring for a client who is receiving the first dose of a newly prescribed IV antibiotic. Which finding observed by the nurse would indicate an allergic reaction? A, development of oral thrush. B, a decrease in a heart rate from 80 to 72. C, development of swelling in the lips. And D, an increase in systolic blood pressure from 102 to 115.
Okay, I'm seeing A and C. Yep. Oh, yep. A and C looks like a D.
Okay. So what we have to do here when answering this question is look at what the question is asking. Which finding observed by the nurse would indicate an allergic reaction? You can take the antibiotic out of this. They are asking what is showing you that this client's having an allergic reaction. If you go through the development of oral thrush, this can be a side effect of an antibiotic, right? But it's not indicating any kind of allergic reaction. B, a decrease in heart rate from 80 to 72. That's not significant. Development of swelling of the lips. Hey, that is showing an allergic reaction, right? Hives, swelling, difficulty breathing, things like that. And then D, an increase in systolic blood pressure from 102 to 115. Not super significant. People can fluctuate their blood pressures all the time. So the correct answer here is C, development of swelling in the lips. So knowing what the questions are asking and not getting distracted by some of the extra information is going to be important also. I'm sorry, they're taking down a stump right outside my window, and I shut the window, but if you can still hear it, I'm sorry. Okay, health promotion and maintenance. This is where the nurse provides and directs nursing care of the client that incorporates knowledge of expected growth and development, prevention and early detection of health problems, strategies to achieve optimal health. This is where you're going to see concepts such as the aging process, pregnancy, postpartum, newborn care, peds situation, health promotion, screenings, self-care, things like that. All right. And I think you're off the hook for questions with this category. So we'll move right into psychosocial integrity. And this is where the nurse provides and directs nursing care that promotes and supports emotional, mental, and social well-being of the client experiencing stressful events, as well as clients with acute or chronic mental illness. So examples here, you'll see abuse and neglect, behavioral interventions, coping, cultural situations, mental health concepts, substance use and disorders will all be included in that. And we do have a question here. So the nurse is caring for a client who is experiencing an acute phase of schizophrenia and is exhibiting positive symptoms. Which findings should the nurse expect to observe? A, the client reports that the call bell is a tracking device. B, the client avoids eye contact. C, the client refuses to get out of bed. Or D, the client has difficulty with eating.
Okay, looks like a couple B's, an A. So B and A seems to be.
A. Great. Let's work through this one then. So when answering this question, you need to understand what positive and negative symptoms are of schizophrenia, okay? You need to know the difference between those two. So if you are like, oh geez, I can't remember what positive symptoms are, you can also kind of look at trends in the questions. So if you see B, C, and D, these are all very similar. They're kind of more so withdrawing. And then A, it kind of stands out compared to the other ones. So then if you're not really sure, then you can sometimes, not always, assume, okay, maybe A is the answer because this one, the other three are very similar. And then this one stands out amongst the rest. So if you are reviewing, then you would know that A is considered a positive symptom. And then the other three are more negative symptoms for withdrawing. So the correct answer is, hang on a second, is A. Because, and you can also use, like I said, as a study tool, you can use these Q banks. Even let's say you got the question right? You're like, okay, cool, I got it right. But go back and understand why the other answers are wrong. If you're like, I didn't fully understand that, it was just kind of a good guess, go back and review some of that. Might want to clarify what is meant by withdrawing in this context. I would say just if they're avoiding eye contact, they're refusing to get out of bed, difficulty eating, are less, I guess withdrawing would be kind of the
Social,
word.
less social, withdrawing from
Yes.
interactions from others.
Correct. Whereas the positive symptoms are more delusions, hallucinations, things like that. So that's the difference between the positive and the negative symptoms, like I said. And if you maybe don't remember that as your, oh, okay. Yep. No, not withdrawing as far as from a medication, withdrawing meaning more so behavior. Good to clarify that. Yeah, I was talking more withdrawing behavior. So yeah, so understanding why you got it right or why the other ones are wrong is helpful also. Okay, and then there is basic care and comfort. The nurse provides comfort and assistance in the performance of activities of daily living. So things like assistive devices, elimination, mobility, immobility, non-farm comfort measures, hygiene, nutrition, oral hydration, and rest and sleep are all kind of included in this. These are your basics. These are probably from your beginning of your nursing program. You're going to have to kind of, and this is a lot of times where people struggle because they are so basic, and we've been so trained to kind of do more of the fixing and the assessments and things like that, where we sometimes have to do a little more review of our basics. All right, so I don't think, no question for that one, which moves us on to pharmacological and parenteral therapies. So this is all your medication type questions. So you will see things like adverse effects, contraindications, side effects. These will be your blood product questions, access devices, expected actions and outcomes, just general med administration, IV therapies, pharmacological pain management, and TPN are all kind of included in this. So our question here, a nurse is caring for a female client who is requesting hormonal contraceptives. Which of the following questions should the nurse ask to assess for contraindications? A, have you ever had a blood clot? B, how many children do you have? C, do you drink alcohol? Or D, did you experience acne in adolescence?
We have A. Looks like A.
Okay.
One guess.
Very good. I like it. So the correct answer is, in fact, A. So what they're asking here are which clients are, kind of the side effects of hormonal contraceptives and contraindications for those. We know those taking hormonal contraceptives are at risk for DVTs and blood clots, right? So we want to see if this client has ever had a blood clot before. If that's the case, they may need to switch to a different method of birth control. How many children you have, alcohol, acne, these are all appropriate questions to ask when assessing the need for hormonal contraceptives, but this is not a contraindication for receiving that medication. So very good. Okay, and then this reduction of risk potential. This is where the nurse is going to reduce the likelihood that the clients will develop complications or health problems related to existing conditions, treatments, or procedures. So basically keeping them status quo, making sure that we don't have, so just kind of tracking how they're doing with their disease process, any interventions we give them. So you can see here, this includes a lot. So changes and abnormals in vital signs, diagnostic tests, lab values, potential alterations in body systems, potential complications of diagnostics tests, treatments and procedures, complications from surgical procedures, therapeutic procedures, things of that nature. How are we reducing the client's risk for further damage? And I'm not sure, do we have a question on this? I don't think we have a question on that one. In physiological adaptation, this is where the nurse manages and provides care for the clients with acute, chronic, or life-threatening physical health conditions. So these are your kind of more traditional questions of caring for a patient in a clinical setting. So alterations, in body systems, kind of your assessment findings, fluid and electrolyte imbalances, hemodynamics, illness management, emergencies, pathophys, unexpected responses to therapies, expected outcomes. So for this one, we want to know what is expected to go right with different treatments and things like that. We also want to know is what could potentially go wrong. Okay. So being aware of that. In this one, we do have a question. So the nurse is monitoring a client who is receiving external beam radiation therapy to the upper chest. The nurse notes the area of radiation has redness and skin breakdown. Which action should the nurse take? A, apply lotion to the red areas. B, cover with an occlusive dressing. C, wash the area daily with warm water. Or D, draw a circle around the area to monitor for changes. This is a relatively common question, but can kind of be tricky sometimes too. So.
Okay, we have a D and C.
Okay. All right. So for this type of question, you will need to review the skincare for radiation therapy. That's different for just general skincare. So a lot of people will pick, let's kind of break these down. Apply lotion to the red areas. We never want to put lotion on our skin after any lotions, powders on our skin after radiation therapy or during that, right? So we know that. Cover with an occlusive dressing. We want to keep that open to air unless we have, significant skin breakdown, open blisters, things like that. So we want to keep that open. Wash the area daily with warm water. This is an appropriate response. So, and then a lot of people will also pick D. So drawing a circle around the area to monitor for changes. This is a normal skin care or wound. If someone's got something going on with their skin, a rash, an outbreak, things like that, that is a normal thing that we do to monitor for changes. However, not in the situation of radiation therapy, mostly because they will have radiation markings on there. So we want to make sure that we're not interfering with those. So the correct answer for this one would be C, wash the area daily with warm water. So again, sometimes that's just reviewing the skincare for that specific procedure. Okay, and that was the client need categories kind of in a nutshell. Like I said, you can review these in an extended version through that QR code in the test plan that we had given you. And that's just another breakdown of the client needs categories and the percentages. Okay, next, let me see where we're at timeline wise. So next we're going to move into the next gen Nclex items. So we talked a bit about what was not changing. Now we'll get into a little bit about what is changing. So as you can see here, nothing super significant except for mostly the types of questions. You still have the same time. You have a few more total questions. You are going to start seeing case studies with these next gen. You'll have 3 for sure. We'll get into that here in a minute. Total scored items is a little higher. And then you'll just also have some different item types, and your scoring will be different also. So we'll get into that here in a nutshell in a moment. So the test design, the length of the exam is going to vary by the candidate's ability. So we just kind of break down the minimum and the maximum here. So candidates with very low or very high abilities estimate, you will end up with a total of 85 questions. Again, don't get wigged out if you get past this minimum, if you keep going past this. Just focus on each question. But at the minimum, everyone's going to have 3 scored case studies now. So each case study is 6 questions. So you'll have 18 items with this total. You will have a case study is one situation that follows you, and then you have 6 questions within that same situation. The information may develop over time with those 6 questions, but know that they will be, all 6 questions will be together, as far as you won't move on to some other random questions and come back to that case study. So if you get 2 with the same situation in a row, you can be like, oh, okay, now we're in a case study situation. You'll have at least 3 of those somewhere in that minimum amount. And then 52 scored knowledge items. That's just your typical, usually select all that apply, multiple choice, that type of thing, just normal items. And then, so there's 70 scored items. You'll also get 15 unscored pretest items. You won't know what these are. These are going to be, these are questions that they are testing out, essentially. They are unscored, they're running, getting data on them, how test takers are answering them, seeing if they're an appropriate question to add to the official scored questions. So you can see the pre-test items can be presented in a variety of different forms. So either way, you'll have 15 items or questions. You may get case studies. So as we said, a case study is 6. So you might get 3 more case studies. Wait, did I do that right? The math right? You might get 1 case study and 9 standalone. You can see it all down here. 2 case studies and 3 standalone items. That's the math. Okay, so you won't get 3. You will get, they can break them up in many different ways, but either way, there will be 15 that are unscored. Like I said, you won't know which ones these are. You still attack each one as though it is a scored item. Now, if you move on to the max length of the exam, you will still have your 3 case studies. And then they'll get into other scored items. And then you'll start seeing more complex questions that we'll get into here in a minute. These are standalone questions. They're clinical judgment standalone questions. In one question, they're gathering a lot of information about how you are processing that information. So we'll kind of get over those in a minute. Okay, so these, this is just kind of a chart. You can see what the case studies cover, and then our standalone questions is once you go beyond that minimum, you might start to see a bow tie type of question or a trend type of question. And we'll get into the differences of these here in a second. All right, everyone wants to know about scoring, all right? So we get partial credit. Before it was either full credit or no credit. So the next gen, there's a few different ways that they can score using partial credit. So you can get 0 to 1 scoring. So you earn a point for each correct answer and 0 points when you select an incorrect option. Let's say you have 5 options, A, B, C, D, E, okay? The correct answers are A, B, C, but you only answered A and B. So you get 2 points and then you don't get a point for missing C, okay? 2 out of 3. Plus minus is you earn a point when you select a correct answer, but lose a point when you select an incorrect option. So same example, correct answer is A, B, C, you answer A, B, you get 2 points for the 2 correct, but then you minus 1 for the one you got wrong. So then you end up with 1 point. You will not go negative points for those, so don't worry about that. And then rationale scoring. So this is where you only earn your points if you have to get X or, A and B right, or you have to have this one and that one right in order to get the point. So you have to have 2, depending on what the question type is. And we'll give you examples of those when we kind of get into the item types. Okay. So we will kind of breeze through these item types just so you have you're familiar with them. And like I said, Megan's going to send out the PowerPoint. I believe she said you'll have this recording so you can refer back to these, but just so you get an example of what they look like. So here you have your traditional multiple choice. We don't need to go over that, but as you can see, your information is different. You'll be able to get a lot more information about the client as far as looking into their chart. Okay, so you might see this more so in a case study if it's considered next gen when you have that type of information associated with it. Extended multiple response. This is basically similar to a select all that apply, but you need to pay attention because sometimes they'll say select 3, select 4. So really paying attention to what they're asking. But again, you've got the same kind of information that you can click around. Extended drag and drop. So here you would you basically follow what they're asking. You would drag the correct answers over to the next boxes. That one's pretty self-explanatory there. So close or drop down, this is a great example of that rationale scoring, okay? So you might address this and you have to get this and this right to get the point. The other ones, not the multiple choice, but the multiple response, things like that would be examples of more the rationale, not the rationale, excuse me, the partial scoring types. Enhanced hotspot and highlighting. Here's where you'll get a piece of information and you will highlight the answer as far as, are you able to pick out what's important in the notes or what they're looking for? Okay, kind of a different one.
I'll add one thing here.
Yeah.
The options are pre-highlighted. So as you move your cursor over the question, you'll see what the examiners have highlighted, and then you pick which ones they are. So you are not highlighting per se.
Yes. So you don't have the whole thing at your, that you have to decipher through. Good point. Thank you. Okay, and then there's the matrix or grid. You can see you'll get some potential. They could be set up in a variety of ways as far as expected or unexpected symptoms of a disease process, but this is potential orders. So anticipated, contraindicated, not essential, things like that. Another good example of that plus minus or 0 to 1 type of partial scoring. Okay, now this is your bow tie type question. It's called a bow tie because it looks like a bow tie, right? So what is significant about this is the type, is the item type. When I say item type, that's the actual question, how you're answering it, not the information that's given to you. So this will not be in a case study. This will not follow you. This is one set question, okay? So you'll get information for that client, and then all your information is there to answer this type of question. Again, it's how they get a lot of information from you in one question. So I always recommend with these, if you come across them just in practice somewhere, start with your condition you're most likely experiencing, and then you can move on to actions to take, parameters to monitor based off what you kind of think you know what you're dealing with, right? So that's what's significant with those bow tie questions. And those are just going to show up, like I said, once after you hit the minimum, you might start to see these. And again, a lot of people like them. You got a lot of information. So it's you have a lot there, a lot of information, which is kind of helpful actually. Okay, and then the standalone trend is another type that you might see after your first set of questions. What's different here is the information you get. So the item type where you saw the bow tie was like that cool kind of bow tie design. The item type can be really any next gen type of question, multiple choice, close or drop down, extended drag and drop. So how you give the answer can be any number of those. But a trend, the information is different. So it's maybe someone who's being seen on a weekly visit, or maybe you're taking care of a person who's been there for 6 days, you know, so it gives information over a period of time, and you need to determine how you're going to process and deal with and use that information to care for your patient. So that's what's significant there. Bow tie, you get the bow tie item type, but the information is kind of like next gen with the chart. With this one, the information is presented differently, and the item type can really be anything. Okay. Doing okay with time?
I keep forgetting I'm muting, but we have 10 minutes.
Okay. So now we'll move on to our individualized prep plan for how do you get through this? How do you study for this? This is kind of a lot, you know, it's hard to sum up everything you've learned and in however many years for one exam. So again, here, this is your test plan you can download. And what you need to do is review the activity statements for each client needs category like we had discussed. Are there any specific activities that you're unfamiliar with that you need to review? A lot of students like to study what they know because it feels comfortable for them. So I would say, or, as you're studying, you always start at the top of and then move your way down. Well, maybe try starting at the bottom of your list and move your way up, because I feel like you always feel more comfortable with what you started with. So don't just study what you know, study things that you are more unsure of. And then use your activity statements to guide your review of concepts. So is it meds, diagnostic tests, therapeutic procedures, diseases? So what activity statements could be used to test your knowledge about a medication or drug classification? We know that's kind of more so the pharmacological parental therapies. Understanding what are used to diagnose, treat, prevent complications, and what is the nurse's priority or role? This is really huge with getting through the Nclex exam. What is the nurse's role? The Nclex is reviewing how you work as a nurse. You are not diagnosing, you are not prescribing. Yes, are there some questions related to anticipated, diagnosis or anticipated, but the vast majority is, remembering your nursing process, getting a really good assessment, independent nursing interventions, remembering your ABCs. Some people, especially at the end of their nursing school career, get more focused on provider details, prescriptions, orders, that type of thing, when we need to remember our role as the nurse when taking the Nclex. And then, so as it gets into diseases, we want to focus on not even necessarily specific diseases, but the overall concepts such as perfusion, gas exchange, that type of thing. So understanding, okay, COPD affects our gas exchange. So then what type of nursing interventions do we do to help improve gas exchange? What type of assessments are we doing for this type of patient? Not, oh, this is what type of meds they need. That will be a part of it, but understanding the concept rather than just specifically the disease in general is going to help you answer those types of questions. And then practice questions. Like I had said before, really this will be kind of your best friend. Find some kind of Q bank. Like Megan said, the Princeton Review has lots of different options for you if that's the direction you choose. Find some kind of assessment once you get through so you can see where your weaker areas are. So there are lots of places, and like I said, we have these at the Princeton Review too, where you can get those practice assessments. Essentially, it's a practice Nclex, if you will. And at the end, you will get feedback of, okay, what client needs categories did I score lower on? Once you get those, focus your practice on those. If there's a few handfuls of ones, if you're good on basic care and comfort, obviously don't completely ignore it, but don't keep practicing basic care and comfort questions. Familiarize yourself with all question types for each client needs category and activity statements, okay? Diversity with your questions. Choose questions that cover, we said different activity statements, not just systems or populations. And one of the things I highlight most is, especially once you're getting closer to actually taking the exam, mimic your test taking environment. So a CAT exam, you can't necessarily do this just if you're working through a Q bank, but really focus on, are you able to sit for long periods of time at high concentration? Can you sit and answer 150 questions without checking your phone, checking your email, going to let your dog out, any of those things, getting a drink. You'll have breaks, of course, for Nclex, but even the first break doesn't happen for a while. So practice being able to sit for a long period of time. And that's a lot of times what will get students in the Nclex is they get tired after a while. So they just kind of are going through and they're not as focused. So practice sitting, mimicking your environment, no distractions, and just focusing on questions. And then once you kind of are able to practice that a little more, then it's less kind of difficult to sit through and focus. Focus is always a problem these days with our phones and our scrolling and our distractions in our everyday life. So I know that's part of the beast of exam taking. All right. And I think that's all I have on my end. So Megan, I'll turn it over to you. If I'm leaving anything out, please feel free to jump in.
Okay. Well, great. Thank you so much for all that great information. I do realize giving you all this information in an hour is difficult. So it was very light, but if you have additional questions, please feel free to reach out to me. I will utilize my experts like Melissa to answer the nurse-like questions. I can answer test-like questions. I'm happy to do a consultation if you want to talk more about, a study plan. How do I make a study plan? That kind of thing. And I will send that in my email, or you can just email me here directly. But with that, we would like to open it up to any questions you have. You can take yourself off mute and just ask them since we're close to being done.
And just a reminder for everyone, this was recorded, so you will receive this recording to go back and reference any of the material. So just a heads up on that, this was recorded.
No questions? Nope.
All right. Well, I do. Oh, we do have one question in the chat.
Why do you think the pass rate increased so much with next gen? Melissa kind of alluded to that, because with our feedback, what we're getting is students felt particularly with the case study, you're given you're given a situation and then supporting documents that give you real life information, labs, you have nurses' notes, you have other references. So when you're asked the question, it's more about, can you find the answer with what you have? Can you extract your knowledge? But most of the time, one of the biggest hang up with people, as Melissa was talking about, is you read the question so fast and you think, oh, I know it. But really, it's one tweak of a word that differs between the two answers you're deciding between. You can eliminate two maybe, but two you're not sure. And it's that one word and you read it so fast, you pick it. But because you automatically put in the scenario, where you have the scenario right next to you to have the information. So it's a more comfortable feel to answer the questions, and that may have helped with the increased pass rate. I know there's, rumors out there that they, are being kind and it's just going to get harder. But it's a little more complicated than that. They can't just do that. It is a bell curve situation, grading, and so the best thing is I think also people were very concerned about it, so maybe paid more attention to studying and reviewing, and that may have helped increase the pass rate as well.
All right, we're over on time. I do want to thank Megan and Melissa for jumping on and providing this great material. We certainly appreciate it. And again, everyone, this was recorded. We will be sending out that recording, so hang tight on that. But thank you both for providing this information. Like I said, we really appreciate it. And all right, I hope everybody has a great rest of your day. Take care.
you.
Thank you.
Thank you.